right, let's talk total knee replacement. So when patients are told they need a total knee replacement, there's a lot of misconceptions out there about, number one, why they would need a knee replacement, or two, what it actually entails and what the recovery is like. The way that our joints work is at the end of the bones, as they come together, there's a casing around that holds in the fluid inside of our joints, and at the edges of the bones that touch is cartilage. So here's an example of a knee, and in this example, you can see that white is the cartilage. Now, if you ever have a chicken wing or anything like that, it's like the gristle at the end of the bone that you feel. Now, what the point of that cartilage and the fluid that's inside your joint is so when you're moving, there's no or very little amount of friction between the two edges of the bones. So the cartilage acts as a place where the friction is supposed to happen. Now, friction in our body, we don't usually like friction, so the least amount of friction possible is what you want. Hence, whenever you are wearing a pair of shoes that don't fit right, you get a blister pretty quickly because our body does not like that friction. And over time, whether that's caused by genetics, which mostly it is, maybe overweight or activity. I took care of a lot of paratroopers in the military, and they had very difficult knees because over time that cartilage can have damage to it or can thin. When that happens, you get these little potholes or areas where the cartilage is thinning. So when you're rubbing, walking, and moving, you actually get friction, so you get an internal blister, which is realistically what osteoarthritis is. And there's many different ways that we can try to treat that non-operatively, but when patients have failed all of the non-operative efforts, then we start talking about a knee replacement. So because the problem is with the end of the bones, all we're going to be doing is replacing the end of the bones. Now, a lot of people, the misconceptions people have is that we're going to chop off the knee and just throw it away, when realistically, a knee replacement is not that. What that is, if you notice on this model here, is that the bones intact, the bones themselves are intact. It's the end of the bones that we are replacing. So really, I like to call this, rather than chopping off the knee, we're actually trimming the hedges. Trimming off little wafers of bone, we make these 5 individual cuts so that we can shape match an implant at the end of it. And so now everything that's covering the bone, still your bone, but what's covering it now is metal, and that metal is going to be what's replacing the cartilage. And then on the tibia, we do the exact same thing. We cut a wafer of here, and then we place the implant inside, and we place a plastic liner on the inside, so that everything that's rubbing is not yours, so you don't get that friction-related pain or inflammation. The ligaments are all intact, and there's another ligament here. So realistically, all we're doing is making these wafer cuts. We do remove the ACL because it's right in the way where the implant is, but these implants are made and designed so that the ACL isn't necessary. But the PCL, the MCL, the LCL, all of those things are still intact so that it feels like your knee, but what we've changed is this part that's rubbing, that's painful, that cartilage that's bad is what we've replaced. And so hopefully that's not as scary for some patients when we are able to show them we're just replacing the edges of the bone. In order to get into the knee, we have to cut into it. And so during surgery, we make an incision in the front, and we can either just peel back the muscle, or some will actually cut the tendon and move it out to the side so that we can expose and go to the knee where we move the patella out of the way. And then we can do everything through that incision. And once the implants are on, after that, really the recovery process is healing the approach to get into the knee, when realistically the implants are already fixed and the knee replacement's done, but the reparative process is the tissues. A lot of misconceptions there as well, that you have to be in a cast or in a brace, or you can't walk on it, but actually we have you walking on it immediately within an hour. And most of our patients right now are able to actually go home the same day, barring their other medical conditions if it's going to be something that stops them from going home. The goal is to get you up and moving, so our patients are bending their knee right away. They're up walking on it. They're getting around stairs at their home same day, so we can get you back to walking and living the right life that we want you to live.